who I am, who I am. I don't know, my friend. Don't know my name. I just don't really know. I think I should go home. I don't know.
Oh, sorry, guys. I didn't see you there. I'm Erica Lewis, and I take it you guys are here to learn about hyperosmolar hyperglycemic non-ketotic syndrome, or HHNS for short, also referred to as a diabetic coma. It is one of two potentially serious complications of diabetes mellitus. Although this condition is rare and accounts for less than 1% of diabetic hospitalizations, it is still important information to know as a nurse. Why, you ask? For patient care, of course, and to provide accurate information to our patients. But you guys already knew that. Bunch of smarty pantses. HHNS is slightly more prevalent in females than it is in males, and is seen more often in people of African American, Native American, and Hispanic descent. It may affect both type 1 and type 2 diabetics, but is most often seen in adults aged 65 and older with uncontrolled type 2. What this means is that the patient either is unaware that they have this disease and has not been officially diagnosed, or they are not adhering to their diabetes medications. This is commonly seen in the older adult population, often due to the difficulty it is to make hard lifestyle changes. Other risk factors include infections, such as UTIs and pneumonia, accounting for approximately 30 to 50% of cases, medications as well as non-adherence to medications, as I stated earlier, accounting for about 20% of cases, and substance abuse and the existence of other comorbidities, such as having a history of myocardial infarction, pulmonary embolism, or mesenteric artery thrombosis. Oh man, what? It's empty now. That must be my cue. Abby's up next.
Thanks, Erica, for that introduction on HHNS. Because this is a form of hyperglycemia, we are going to see some classic clinical signs like fever, general weakness, tachycardia as the body is compensating, polydipsia because the body is expelling a lot of water, polyuria because the body is trying to expel the excess sugar. All of these are symptoms that are indicative of mild dehydration. Some of the hallmark signs of HHNS, in addition to the normal signs of hyperglycemia, are high blood glucose levels, normally 600 milliliters per deciliter and above, poor skin turgor and tenting due to extreme dehydration, confusion and altered level of consciousness, possibly even putting the patient in a coma due to extreme dehydration. These are the most classic clinical signs of HHNS, and some of the classical signs that are going to be able to help us diagnose the patient with HHNS. Some diagnostic testing that we will be doing for these patients would be checking blood glucose to see how high the blood sugar is. Again, we're going to see 600 milliliters per deciliter up to 1200 milliliters per deciliter. We're also going to be testing for ketones in the blood or urine because patients with HHNS are still producing insulin. They will not have ketones in their blood or urine because of it, because they still have that little amount of insulin circulating through their blood. Another test that we would test for is serum osmolality, to see how much glucose is in the blood. Normal is 285 to 295 milliosmoles per kilogram, and a patient with HHNS will have up to 320 milliosmoles per kilogram. And another test that we'll be doing is specific gravity of the urine, because these patients will have concentrated urine with a large amount of sugar in it. And that's all I have. We'll be passing it over to Andrew.
Because it's likely that a patient has HHNS will likely also have been diagnosed with diabetes mellitus, most commonly type 2. A patient should manage HHNS like any other diabetic disorder. As nurses, we should educate these patients on proper treatment. When diabetes mellitus is well controlled, the risk for developing HHNS is very low. Because the high mortality rate is such an issue, especially in diabetics, and even more so in older diabetic patients, it is imperative that these patients who are prone to HHNS are diligent with their lifestyle changes. The most important thing a patient can do to avoid slipping into HHNS is maintaining an adequate level of hydration, as poor hydration has cascading effects, leading the patient further and further down the road to a severe HHNS episode. The patient should adhere to a strict diabetic diet. What's a diabetic diet, you ask? Well, to be quite honest, it's the diet that we should probably all be adhering to. It's 3 scheduled meals a day in moderate amounts. It's foods that are naturally rich in nutrients and low in fat. It's foods that aren't processed and are low in carbohydrates. High carbohydrate diets should be avoided at all costs. Um, Routine at-home finger glucose checks, along with insulin therapy as needed, should be part of daily routine activities. HHNS patients should get up and move. Um, Avoiding a sedentary lifestyle is important to avoiding HHNS episode. Replace instead with routine physical activity is a good idea. Patients with a history of HHNS should avoid infections and treat them immediately upon the first signs and symptoms. An infection is a common cause of HHNS reoccurrence. This is important because when a patient obtains an infection in their respiratory, gastrointestinal, or urinary tract, they suffer a systemic loss of water. This predisposes them to developing HHNS. Surgical interventions are not commonly associated with HHNS, except in instances where HHNS leads to or is in the presence of other comorbidities. HHNS. After an HHNS patient is released from the hospital, they may need to follow up with specialists depending on the severity of their complications. They may need to see a neurologist if they suffered from an altered mental status. They may need to see a pulmonologist if they were intubated while in the hospital. And it's always a good idea for a patient who suffers from HHNS to see a dietitian, which is someone who specializes in nutrition. They can help develop a diet based on the health goals of the patient and tailor it to their specific tastes and needs. Because HHNS disproportionately affects older diabetic patients, those who cannot care for themselves are at increased risk of developing HHNS, and a home health consultation should be recommended in order to make sure that the patient is able to meet all necessary daily nutritional needs, including adequate hydration, along with optimal quality of life changes. Jeez, it's hot in here. Hey, Derek. Before I toss it over to you, I have a question for you. When does a skeleton laugh? When somebody tickles his funny bone. All right, Derek, you're up.
Thank you, Andrew. I found that very humorous. So now that you've heard an introduction to some of the risk factors from Erica, clinical manifestations, and diagnostic testing from Abby, and Andrew brought us medical management and lifestyle changes, I will quickly hit the main points and give the prognosis and conclude our entertaining and educational time together with some NCLEX style questions. After these, we'll be in the chat to answer any other questions you may have. First, HHNS is associated with type 2 diabetes. It is an extremely high blood sugar level of at least 600 milligrams per deciliter and can be much higher. The difference between DKA and HHNS is that HHNS makes enough insulin to keep your body from breaking down ketones. Extreme dehydration is also another sign of HHNS. Altered level of conscience comes along with that, and that is what you will most likely see a patient presenting with at the ER. A family member may notice them acting confused and they bring them in to be checked out. We will test blood glucose levels and start large bore IVs for normal saline to rehydrate and give regular insulin to bring down the blood glucose level. As we are bringing down the blood glucose level, we need to keep a close eye on these levels because when they reach 250 milligrams per deciliter, we will need to switch to dextrose-containing IV fluids to protect against hypoglycemia. There are two prognoses that HHNS can present with. Neither are good. We can get the patient rehydrated, bring their blood glucose down, and keep their electrolytes balanced all at the same time so they can survive this. And they'll use this as a wake-up call and make the lifestyle choices that my friend Andrew here told us about, like balanced nutrition, routine at-home finger sticks, and physical activity. Or they can unfortunately join the 20% mortality rate that HHNS has. That is 10 times higher than DKA. So patient education, medication adherence, with proper diet and lifestyle choices is the best route to keep with people who are suffering from diabetes and stop them from letting their diabetes reach HHNS levels. Now we'll move on to an NCLEX question. You are treating a patient with hyperglycemic hyperosmolar non-ketotic syndrome. During rehydration and rapid blood glucose reduction, at what blood glucose level do you switch from normal saline to dextrose-containing IV fluids to protect against hypoglycemia? Is it A, 70 milligrams per deciliter? Is it B, 100 milligrams per deciliter? Is it C, 250 milligrams per deciliter? Or is it D, 130 milligrams per deciliter? Answer's in? Answer is C, 250 milligrams per deciliter. I'll pass it on to our other NCLEX questions.
A type 2 diabetic patient is admitted to the hospital presenting with symptoms of HHNS. He states that he does everything by the book and adheres to his medication regimen. Which statements may be contributing to the development of HHNS? Select all that apply. A, he limits his fluid intake. B, glucocorticoids and diuretics are included in his drug regimen. C, he exercises regularly and manages his carbohydrate intake. And D, he recently has suffered a stroke. The answers are A, B, and D.
A 78-year-old type 2 diabetic arrives at the ED with pneumonia. The patient is altered, has a blood glucose level of 750 milligrams per deciliter, and shows no signs of ketones in the blood or urine. What type of diabetic emergency is the patient likely suffering from? A, DKA, B, hypoglycemia, C, HHNS, D, sepsis. The patient is likely suffering from HHNS due to the high level of blood glucose and the fact that he has no ketones in the blood or urine.
Guys, I don't feel so good.
I will be talking about the manifestations that HHNS
Learn a bit more. So I guess you're here to learn a bit of
Bongo la, bongo cha cha cha, parlami del Sud America.